Representative Paul Shomshor, who represents the District 100, and how long have you served actually in the legislature?
Well, first of all, thanks for the opportunity.
Oh, it's our pleasure.
It's always great to have chances to talk directly with the public and let them know a little bit more about what we do in the legislature.
Yeah.
And my name is Paul Shomshor, and I represent two communities in the legislature, about 40% of Council Bluffs and then the entire city of Carter Lake.
Which is really in Nebraska.
Well, the citizens of Carter Lake a long time ago, decided that they prefer to be in the state of Iowa, and we're happy to have them. And I represent Carter Lake, Council Bluffs, and this is my 7th legislative session, 4th term.
Yeah.
And I came in a special election. It was an odd year instead of an even year.
Well, one of the things I'm really interested in, I know that the viewers and readers of Insider Iowa are really interested in knowing how different is this legislative session from, let's say, a normal one in those years that you've served? Is it different?
I think it's different probably in a number of ways. But overall, probably 80% of what a legislature and a governor works on is passing the budget. And the budget is key this year because just the public's fairly aware of some of the challenges the state has had. So where a normal year probably 80% of our work is devoted to a budget, probably 90% of our work this year is devoted to a budget. So that's one thing that's a little bit different, is there's probably more challenges that relate to the budget. Another area that's probably a little bit different is like any organization, a business or a nonprofit or state government, for example, when times are a little bit tougher, we have to take a closer look at our budget, and we're doing that with both revenue items and spending items. So this is going to be a year of transparency. We're doing some work related to tax credits, and we want to make sure that if a particular business or company is receiving a tax credit, that there's transparency to the taxpayer, that the public can take a look at some of those things. So we're working on transparency issues related to both spending and the revenue side of things. Another thing that we're working on is if we have spending, we want to make sure that we're accountable. And the public's probably aware that earlier this week the House took its first opportunity of passing a state reorganization bill and looking at finding efficiencies within government.
That looks pretty hard to do because reorganization always means somebody's going to have something moved somewhere. How is that going?
Well, actually, the way the process works is each branch of the General Assembly has to pass it. So the Senate went first, and their particular piece of legislation resulted in over $100 million in savings, and then the House took its opportunity to take a look at that, and there were disagreements or discussions with the Senate. There were pieces in the Senate bill that the House didn't like, and we found some more savings in some areas, and there were some areas where we said this might not be the best idea to reorganize government in this manner. So the House version, we came up with $124 million in savings, and now the Senate will take a look at the House bill, and they can do one of two things. They can send the bill down to the governor as the House is passed over to the Senate, or they can disagree with a few other points, and if the House and the Senate don't ultimately reconcile, we'll go to a conference committee. But overall, there were some issues that were different, but probably 99% of the bill, the Senate and House were in agreement.
That brings up another point, which is a little different, but people are really concerned about the decline in cooperation between the Democrats and Republicans, especially at the national level. How is that feeling at the state level in terms of, we've got Democrats, Republicans in the state legislature. Do we still have bipartisanship in Iowa?
I think, generally, I don't think the state of Iowa is probably quite as partisan as at the national level. I think you find situations within state government where Democrats and Republicans, work this state reorganization bill. It passed out of the House unanimously. So I think, both Democrats and Republicans, there's certain issues that they can work together, and, we want to reduce, waste within state government, and I don't think that's a Democratic or a Republican issue. And we were able to work together on that. There will be disagreements, related to tax issues or budgeting issues, but, a lot of the issues in Iowa, policy issues that we work on, don't cut in a partisan manner. A lot of times, those issues sometimes even cut, or there's disagreements based on urban versus rural, and those are not partisan discussions at all. I mean, those are honest disagreements.
One of the issues that seems to be getting visibility, and we're here in the State House today, there's a rally on healthcare reform and so on. What is that all about? What are we at the state level thinking about in terms of tackling healthcare reform?
Well, I guess, any form of government, I served on a city council, and, a lot of the issues a city has to look at corresponds to a state. I mean, the state sets up a lot of the rules for things that cities can do, and, similar to that, the federal government sets up a lot of the rules for spending, and, for example, Medicaid is a program for, underprivileged individuals that, don't have access to health care. And, in the state of Iowa, we have the Medicaid program, we have the Hawkeye program, and a lot of those health care programs are impacted by the federal government because, one, the states administer Medicaid, but a lot of the funding comes from the federal government. So, if the federal government takes action, it impacts what we do in the state of Iowa. Now, the state of Iowa, we've done a good job of trying to move towards, full coverage where, if you're a child in the state of Iowa, you have health care. And, we've gotten very close to having, all kids in the state of Iowa